So we're going to start super simple. Can you just introduce yourself and your role here at SNHU?
Yeah, of course. My name is Dr. Ashley Love. I am the Director of Public Health here at Southern New Hampshire University.
Well, it's great to meet you. And we are talking about National Public Health Week in this interview. So for the first question, what does National Public Health Week mean to you?
It's a time for especially public health professionals to reflect, reconnect, and recommit with the community that we serve, as well as shining some light on the people and programs that shape the community health. So through education, prevention, care, and innovation. So for me, it brings back like faces and stories from my personal days in Harlem to today's classroom. So it's just a reminder that public health, especially now, is about trust, consistency, and compassion. And it's before the clinic and also beyond the crisis. Because I think when we talk about diseases and um, pandemic, etc., we're not also looking at some of the invisible things that we're doing: clean water, clean air, the things that we do to prevent diseases before it becomes a crisis.
So can you tell us a bit about your own experience in the public health sector?
Sure. My journey actually started in Harlem in the 90s, supporting the HIV and AIDS patients during that pandemic in the hospital, where it was a pivotal moment in our nation's history. So when you look back, it taught me how public health can either build trust or break it, just because during that time, there was also misinformation, stigma, and a group of people that was marginalized because we didn't know a lot about HIV and AIDS. And it was infectious disease that was, you can get it. So it helped me to carry that lesson forward. And I had the opportunity to be the state epidemiologist in Delaware during the H1N1 pandemic, which helped me to lead the responses and the pandemic efforts to build systems and also train others to adapt to different pressures, especially during crisis. Because I think when there's crisis, it sometimes people can act or sometimes are paralyzed with what are we supposed to do. And for me, what's unique about my background is I'm still active duty military spouse. We've been serving over 2 decades. I thought we would retire out of it, but we're still serving. And I've lived across different continents and cultures, moving every couple of years. So always centering around people in the process is always important to me. And for me, public health helps me to teach and design programs. Right now, I am involved with AI and workforce development, and especially health communication to build a stronger and more connected public health for the future, so we can build capacity as well as bring awareness and connection, as opposed to some of the things that are happening that is polarizing a lot of us on different issues. So yeah, that's been my journey so far. So purpose, mission, service, and public health allows me to dip into different disciplines and get everyone to kind of work together for the same vision and mission.
Well, it sounds like you've had an amazing journey. This year, one of the themes for National Public Health Week addresses the future of public health, stating that the future of public health starts here. This speaks to a strong and resilient public health workforce being the key to keeping communities healthy and addressing the nation's most urgent health needs. What type of roles do we currently need most in our communities and where?
Yeah, no, that's a wonderful question. And of course, it's a $1 million question too, right? In terms of what we may need. And for me, as a public health professional with, over a quarter century experience, I can't believe I'm saying this because I still think I'm in my right out of college. But communities need health educators, mental health advocates, because we're under a lot of strain with, unpredictability of economy, our environment, global crisis, digital health specialists, because there is a digital divide. When you look at the generations, baby boomers, Generation X, for instance, and all the future, the current generations, we have people who are digital natives versus someone like myself. We had to adapt to learning about the internet, social media, etc., and also trusted communicators, meaning people who can kind of reach out and allow us to kind of bridge and work together despite our differences and find some roles that are critical and bridging in, especially in rural regions, growing metro areas. There we have a growing aging population. A lot of folks are retiring as well, in our military communities, where we want to just make sure that they're also taken care of. So anywhere we need healthcare access, trust, and capacity are stretched, we need people who are able to build as opposed to divide, and also be able to compromise and find that resiliency, as well as the positive and also commonalities among all of us, because at the end of the day, I think all of us want to improve in our qualities of life, and we want to stand together for a cause, which is really important. So we need professionals who can do both, like technology and also the heart behind the public health work, the compassion, the connection, and also the ability to find that compassion in everything that we do, and giving that a second chance, where not automatically think that people are coming from a negative space, but there's a lot of things that people are handling right now where we're only seeing the tip of the iceberg. Everything is kind of buried. So I think it's so important to have people who are good communicators. So,
It's a great answer. So, what are some of the ways a degree in public health can help prepare graduates to take on the necessary roles in communities?
yeah, no, thank you so much for asking that question. Of course, I'm going to be a little biased because I am the director of public health program, but I do have some experience because I do have a lot of degrees in different disciplines. And the public health degree is very unique because it builds leaders who can think critically and act decisively. So for me, being in a pandemic situation, you have to make some decisive decisions to move forward, regardless of how much information that you have. We've seen it with COVID. And of course, sometimes when you make those decisive decisions without a lot of knowledge, because it was a novel virus, is the fact that sometimes people will agree with you and not agree with you. So it trains students to especially interpret data. I think it's important to use data and evidence to support what you're saying, also lead the system. So not just individual basis. So we may have this conversation, but when you look at it from like 10,000 feet, you see the land differently. So looking at systems and also going back and forth between individuals and system, because when you're only thinking systems, you lose the population, which you may see sometimes. Designing novel programs. So I think one of the things that I hate hearing is we've done it this way all the time. It works. Because everything is changing, all the players are changing. It's important to design programs where we have the foundational skills, but willing to take that courage to make that leap, to make some changes. And the connection, I talk about this all the time, is you can't be an island or a silo. You have to work across different disciplines, meaning we can't just work with public health professionals. We have to work with politicians. We have to work with psychologists, psychiatrists. We have to work with economists. There's a whole bunch of disciplines and also players, small business, also teachers, children, you name it. We have to work with everyone to connect and move forward with what we're trying to do. So I think with public health, it gives the students an opportunity to enter into government, academia, tech sector, nonprofit spaces, for-profit spaces, to provide different insight, purpose, and agility with the foundations that we give for our public health professionals. So I used to be a bench scientist as well. So from the bench scientist and working with people, I've worked in hospitals to academic settings, from community colleges all the way to graduate levels, online setting, hybrid, face to face. So I think the flexibility of the degree is wonderful in terms of where you want to take the degree, how you want to make the impact, and it doesn't have to be traditional whatsoever. So yeah, degree in public health will give you an edge, and also that system level kind of thinking that can help you, especially in the leadership, where you have to make some tough decisions.
Well, this is such an important degree and program. That was my last question, but was there anything else you wanted to say before we wrapped up?
So I do want to say that our MPH program is a CEF accredited program. And so it allows us to make sure that we are meeting all the competencies of public health professionals who are going into the workforce. And also, they're able to take another exam, which is certified public health exam, to show their credentials, because only people who are CEF accredited, graduated from a CEF accredited universities, can take those exams.
I mean, it's such an important field, especially since 2020, obviously. So it's great to talk to you.
I think for me, up until the COVID pandemic, no one actually knew what I did for a living, because when I said I was an epidemiologist, can you look at my skin? I'm like, no. And so I think, as devastating as it was in terms of COVID, I think public health was able to get the spotlight. However, I think another thing that was that also shed a spotlight is, the scarcity of funding and resources for public health, as well as the tailored messaging that we need to have. So some of the younger folks who are influencers and are able to communicate to the younger population, as well as the aging population and diverse population. Like, we needed communicators from all those groups. But I think what happened was, since we were sending out all that information pretty quickly without knowing everything, especially that first year, it was tough, because we thought, this may be the pandemic that is going to kill us all, right? Is at the back of a lot of people's minds. So that was interesting. But I do want to share two things with you. So we were stationed in California, in Northern California, during the start of 2020. So all the cruise ship, remember the cruise ship folks? And they ended up at my base, where we were stationed. So I had the pleasure of, I was able to witness exactly like what was happening. They were quarantined, and then just, the stories just unfolded in terms of, the World Health Organization declaring, the pandemic, etc. So I thought that was very interesting, where I'm like, wow, I teach this stuff, epidemiology and biostatistics, and then right, down the street, because we were stationed and living on base, that all this was happening. And it was a very interesting period, just because I was able to shed light to a lot of my students, because at that time I was teaching epidemiology. So I think the students actually had that light bulb moment of all the terminologies and why you're learning it. Because you usually get those comments like, why, Dr. Love? Why is this important?
I guess I
Yeah.
did have another question then, because you mentioned HIV and AIDS in the 80s, and you mentioned H1N1, which I think was early 2000s, right? If I'm not mistaken. And there wasn't a lot of social media back then. So how do you
No.
combat like misinformation? Because you mentioned younger people trying to get the message out there, and like obviously there was a ton of misinformation during COVID and even now. So how do you get the right information out there? I guess would be my question.
Yeah, no, that is something that I shifted my focus, especially like I said, I was a bench researcher going into human research, right? So communication is key. Misinformation is always going to be part of our daily lives, but especially in the so for me in the 1990s when I got involved with the AIDS and HIV patients, I think it's word of mouth at that time because there was no social media. There was, newspapers, and I think having that relationship with the media, journalist, and also at that time I was living in New York City, so my circle of friends were not just public health professionals, but it was Wall Street people. There were journalists, there were different walks of life doing different things. So having a diverse network of people that you surround yourself is going to be really important to get the right message out there. So, as we saw with the outbreak, you talk to two people and it becomes four people, it becomes eight people. So, that's how you can kind of talk about your truth. And also, I think what we don't do well as academics and also public health professional is we start, like I said, I love statistics, biostatistics, epi, is we don't give any kind of context or personal story behind the numbers. So, from my years of experience, I think for me, when I was starting out, I felt kind of naked. Like, I don't want to talk about myself. It's going to dilute the scientific, knowledge, especially because I graduated from Columbia. So, all the folks are like, stick to the facts, stick with the statistics. And, we talk about p values and but the general public doesn't understand. It's like, you're only 95% sure that this is going to be right. And that means a lot for the scientific community, but it doesn't really say much to the general public. So I think for me, now I'm more comfortable sharing about my stories and my failures and things that I have noticed over the years that I think giving that authentic personal story as well as also building that connection with people is going to be really important for um, the right communication. So even with social media, I think I'm not as well versed. I think the only social media that I feel really comfortable is probably LinkedIn. Um, but what I've noticed with very successful influencers are the ones who are able to connect with their audience and share important facts, as well as they're publishing in, academic journals, but also in mainstream media. And they're not afraid to, go to media, talk about things. And you don't have to be, polished per se, but you learn, by doing and being able to connect with others. But I think if there's more of us out there talking about our science and what we're doing and the truth, I think that's going to help us to dispel some of the misinformation out there, and also not being afraid to connect with some of the younger generation who may not have the academic knowledge, but kind of partner up with them